HIPAA doctor interactions. This is going to be a really interesting topic. We're going to be diving into patients interacting with their doctors or finding a doctor, being able to have a back and forth workflow using things like telehealth, appointments, being able to schedule at a particular location, and just generally being able to self service as much as possible while doing this in a HIPAA secure and private way. Okay, let's dive in. Okay, so just to get us started here, we're going to dive right into kind of a classic example where we have an online pharmacy and the user is requesting a refill. So here we are at the user's dashboard. They're going to request a refill. Here you can see this is kind of an example of what they might see on the product details side for one of their orders, and they could see how many refills they have remaining. So depending on the prescription, they may be able to just request a refill online and that's it. And the doctor or the pharmacist, respectively, could approve that refill request. So alternatively, they may have to schedule an appointment and be able to make an appointment to talk with the doctor and then have that kind of prescription filled by the pharmacist, etc. And they may have to talk to a pharmacist as well. So the idea here is that they can go in and make appointments, manage appointments, and see the details of those appointments and cancel, reschedule, or go ahead and start the appointment. And we can integrate, in this case, with a telehealth provider with basically video conferencing that is HIPAA secure, as well as telechat. So they can use chat as well that is HIPAA secured too. So the idea here is that we've got to be able to marry all of these potential resources so it's useful for the user and very kind of well thought out. As well as for the doctor. Now, this is probably one of the most critical aspects. So here you can see we're logged in as the doctor. Typically, the doctor is going to be pretty busy, and we need to interface properly with their scheduling system and make sure that all of the technology is seamless and easy to use. So in this particular case, the doctor's going to receive a notification. Then they would go log in, and then they can actually get into the details on a request that they have. Now, this is showing a request for a prescription, and then you can see that they can go into the request and grant the request. They can fill the request, etc. Now, the other thing that they can do is they can go in and look at the patients and kind of see information about the patient, and they can provide a refill, etc. here. They can also set and manage appointments from the appointments area, and they can actually go join the appointment or reschedule or cancel and provide notes, etc. So the idea here is that this is really a communication hub between the doctor and the patient, and it allows other related parties to join in. So we could have team members at the doctor's facility jump in who are authorized to have access. We could have pharmacists or other healthcare professionals who need to be looped in, specialists, etc., and basically make it a seamless process for them so they can access the information they need. They can't see anything more than that. We're logging everything. We're encrypting it all securely. And basically, we are facilitating the patient to get that care that they need and doing it in a very intelligent way. Okay, so let's take a look at another example. Now, this example is for a kind of Bluetooth-enabled device that's going to be taking data in for the patient. And for this particular situation, the patient is using a glucose meter, and they are pulling the data in via Bluetooth to an app on their phone. And the phone app works on any standard device, iOS, Android, etc. And it then publishes the data to this user's dashboard. And so here we are in that dashboard. So now the user can actually go in and invite people who are supporting them. So this is pretty interesting. So this can include a doctor, it can include a medical specialist, it can also include just a supporter as well. So this is pretty cool. So the user can actually go in and invite people, give them different roles, the user type that they are associated with. So they can be support team or they can be a medical professional. Of course, based on those different roles, that would give them different access. And so here is the invite screen where they can do that. A couple other examples that we want to share with you. This one is pretty interesting because this one is allowing the patient to complete some prerequisite steps, talking about kind of their symptoms, giving information about them, going through a consent form, and then kind of confirming everything. And this is going to be a telehealth model. So whenever the patient gets done kind of going through this process, it's telling the user that they are going to be in touch with a telehealth provider. And then the telehealth provider will schedule and meet with them. So this may be a doctor or a pharmacist, etc. And this will send a notification to the doctor so that they can actually go through the process and complete all the necessary steps. Now, then the doctor has the ability to complete a signature and a process on their end with the appropriate form. And let me just briefly pull that up for your review here. Okay, so this is an example of what the prescriber would sign and go through. And you can see that basically they go through and sign off on all of these forms, and they have to insert certain data. So they're going to go in and select a code, the appropriate code, add their signature, and then add the date. Now, of course, they're going to review this form in detail and then basically sign off that they are prescribing this and they're completing an e-signature. And essentially, this would tie in with the telehealth appointment with the end prescriber, or I guess user. So that's a really interesting process that they go through. One of the other things that we'll point out is we also have the ability to set up a location and appointment type of model too. So this is an interesting scenario here where we're going through some questions. The user is providing answers to these questions. And then in this particular case, we are determining if they are a good fit for this type of treatment. And in this case, this device potentially. And then we're helping them to find a surgeon or potentially download and share the information via email or via PDF with their care provider. So this is pretty interesting. And basically, whenever they click on find a surgeon, they have a proximity-based locator that they can complete, and then they can schedule an appointment and reach out to get in touch with the different surgeons that are available who can do this procedure, essentially. So these are just a few examples. There's a lot more depth that we can get into. And really, the big takeaway here is that when you're working on this ability to have doctors interact with patients, we highly encourage you to really think about all of the edge cases, all of the scenarios. If somebody's going on site for an appointment, think about notifications to make sure that they have a reminder, making sure that they have the ability to cancel or reschedule, and just kind of putting governance in place, essentially, to manage the interaction between the doctors and the patients. And then also notifying them of essentially the consequences or also benefits of adhering to that governance. If they can't adhere to some level of kind of respectful interaction with the doctors and the patients, this is going to make it really challenging for your HIPAA platform to be successful. And so it really, really helps a lot to think about this concept whenever you're setting everything up. We also, of course, naturally recommend working with a provider who has experience putting these type of kind of workflows, notifications, reminders, just kind of key factors into place to make sure that your patients and your doctors in this ecosystem you're building are going to be successful working together. Thanks for making it to the end of this video. If you would, we encourage you to consider the opportunity to take advantage of our complimentary discovery process. If you're really interested in getting more information about this particular topic, that is a great way to, in a no hassle, kind of low key way, get to interact with experts within this field. And our commitment to you, if you decide to engage our team for a complimentary discovery or just a complimentary strategy and discussion, is that we will absolutely point you in a positive direction, help you kind of accelerate on your path, even if there's not a good fit for us to directly work together. We have a lot of resources and a lot of experience in this area of focus, and we just encourage you to take advantage of that if you're seriously looking in this space. If there is a good fit, of course, we'll also present you with great options that you can consider for how we might work together. And either way, we certainly appreciate you taking a look at this video. We encourage you, if you think this was valuable, to hit the like button And if you'd like to see more of these videos, go ahead and hit subscribe, and we will look forward to seeing you in the next video. Thanks for watching, and bye for now.